Well, dementia is very complicated, as you know, and it's very difficult to make the jump from what you might be doing in a laboratory to a drug which actually works in human beings. So what the Dementias platform is doing is filling that gap by enabling precision experimental medicine to be done so that we know what sort of drugs are likely to work in which groups of people, and so we can conduct more trials with a greater likelihood of success. Over the last 5 years, we've worked very hard to create a world-leading data portal which allows scientists from all over the world to access some of the world's best cohort data. We've also created networks for stem cells, for brain imaging, and for bioinformatics. And now these are national networks which again bring scientists together to develop the best methods that can be used for dementia research.
So the DFP study has a very broad remit in terms of what it's trying to do. It's born out of the appreciation that the reason so many clinical trials have failed in terms of discovering new treatments for Alzheimer's dementia is based on the fact that, first of all, we're not treating people early enough in the disease process. And if you're going to start treating people early in the disease process, we need to have better markers of disease progression. So what the DFP study does is a lot of different assessments over a very short period of time in a group of people that potentially are at risk of developing Alzheimer's dementia but do not have it at this point. So people come about every 2 months over a year initially and have a range of quite invasive often and certainly arduous assessments. But what we hope will come from this is we have so much diverse data in terms of these potential markers of disease progression.
I got diagnosed in 2012 with early onset dementia, and I didn't know much about dementia back then, so I started doing my own research into what was available. Joined the Alzheimer's Society Research Network, a group of volunteers who get involved in research activities, and everything's flown on from that. Researchers really need people to volunteer to help them in their work. If people don't volunteer, we're not going to get any results and we're not going to find a cure for the disease. Seeing researchers collaborating like this, it's going to make such a difference. We're going to find something years before we would have done had they not been talking to each other. I just feel so much hope and would really love more people to get the knowledge that I've got so they can feel like I do today.